spun down his blood, and we have the platelet-rich plasma right here. And then we're going to turn that into PRFM, which is platelet-rich fibrin matrix. So the fibrin matrix is what builds the matrix that the collagen and cartilage and all the things inside the knee are going to build on. So then we just inject that in, and it gets to work. The body starts rebuilding things inside. So to do that, we're going to get these guys in here. And then the part that Gary does is he won't take any kind of anti-inflammatory, any NSAID, anything like that, low-dose naltrexone, for 3 days prior. And then we have a whole protocol that goes with joint injections. So if that's something you're going to do, we would be giving that to you to explain, like limited exercise on that joint for up to 6 weeks. It really kind of depends on your recovery, but we do want to give that space in there to get things to heal and be able to build up. Because of course, if you're out hiking every day, you're not going to build up good cartilage because you're constantly going to be using it, wearing it back down. So I don't do necks or spines just because that should really be done with imaging, of course. And then, but all the peripheral joints, so ankles, knees, elbows, wrists, shoulders, all of that we can do. And it's relatively painless. It would seem like, oh man, that's going to hurt, but it's not really that bad, right?
Right.
So this is Gary's third injection into his joints. Okay, bend that a little bit more. Perfect. So right there, I'm looking for the entry into the joint capsule. Clean that off really good. And then I'm going to end up with my needle so that it's going to be kind of right in the midline because I want that to go right inside of there. Okay, feel okay?
Mm-hmm.
All right. So
painless.
I'm going to have you straighten out your knee just a titch more. Perfect. Come in from this side as well. Okay, there. So when I get that reaction, then I know that I have gone a little bit too far and I need to just back out. You doing okay?
Mm-hmm.
All right, good. And then, so for these injections, we are looking to do 1 a month for 3 months. And then we're going to do a touch-up probably every year. But that's really just dependent on the patient, what they're doing with their knees, so on and so forth. Okay, and now we're going to do the next joint. And this stuff is kind of magic to me. Just what we can do with it, what we can regrow, just all the things that we can do and how effective it is. And the great thing is that because it's all yours, you're not going to have an allergic reaction to it. There's not going to be any rejection. There's not going to be any problems. Liquid gold, we call it. All right, ready?
Mm-hmm.
Okay, good.
You wear a lot?
Yep, it's perfect. You okay?
Mm-hmm.
All right, now we're going to head over to the inside here. You okay?
Mm-hmm.
And good as new knees. That's it. No knee replacement here. Easy as pie.